In these challenging times, we all have a role to play in keeping our families, our communities, and ourselves safe. I am Dr. Dave Degatti, and I'm a board-certified cardiologist from New York and founder of the social media site Dr. Dave's 411. I am currently on the front lines of the coronavirus pandemic, and I hope to bring you some useful information about the challenges of living in this rapidly evolving situation. We will now learn some of what we understand about COVID-19 to date. COVID-19, which stands for Coronavirus 2019, is the name for the disease caused by SARS-CoV-2, which is part of the coronavirus family. There are hundreds of different types of coronaviruses, first discovered in the 1960s. Some are harmless, some cause mild colds, and some are much more dangerous. Severe acute respiratory syndrome, also known as SARS, and Middle East respiratory syndrome, also known as MERS, are both coronaviruses, and you may remember them from outbreaks previously reported in the media. COVID-19 seems to have first appeared in Wuhan, a city in China, at the end of 2019. It affects all age groups, but to date, the most severely compromised are adults of middle age and older adults. COVID-19 mainly affects the respiratory system, primarily the lungs. The virus starts infection in the lungs and ends there as well. But during the course of the illness, it can cause virus-induced damage to many organs in the body. There is some doubt about the exact incubation period of the virus. This is the time between exposure and the appearance of symptoms. It seems that this can be up to 14 days, but in most cases, to date, it is between 4 and 5 days. What is certain, and this makes COVID-19 particularly dangerous, is that some people experience asymptomatic infection. This means that although they are infected and are infectious, they do not show symptoms. This is one of the reasons it is important to self-distance. Even though you might feel completely fine, you may still be carrying the virus and unknowingly infecting those you come into contact with. In most cases, the symptoms are relatively mild, but in some cases, severe infections develop. Older people, the immunocompromised, and other high-risk patients are at greater risk of developing more serious problems. The duration of the disease is extremely variable. According to the World Health Organization, it is usually 2 weeks for milder cases and up to 6 weeks for more serious cases. Some symptoms of coronavirus are high-grade fever, general fatigue, dry cough, muscle pains, shortness of breath, and even diarrhea. A person may have some or all of these symptoms and not have coronavirus, as many other respiratory illnesses share these symptoms. If you need to be tested for COVID-19, a sample may be taken from inside your nose or mouth and sent for testing. In some cases, sputum or stool samples may be tested. A chest x-ray or CAT scan might be ordered to help in the diagnosis. We will be discussing what to do if you are diagnosed with COVID-19 in a later module. Testing will vary depending on locality and may evolve as the pandemic continues. Due to the ever-changing situation, we have decided not to include specific statistics in these videos. For more detailed and current information, it is best to refer to your local health authorities or a trusted news source. I hope you now feel like you are starting to gain a better understanding of COVID-19. For a number of reasons, COVID-19 is very effective at spreading. It is easily transmitted from person to person, most commonly with the infected person transmitting the infection through respiratory droplets from the mouth or nose, exhaled through coughing or sneezing. COVID-19's global spread has been due to how easy and common international travel is, aided by the long and sometimes asymptomatic incubation period. We also know that COVID-19 can be transmitted through touching infected surfaces, then touching the mouth, nose, or eyes. One common question that people ask is, can COVID-19 be caught through the air? If you come into contact with respiratory droplets from an infected person sneezing, you can become infected. But there is also some evidence to suggest that the virus is airborne by itself and can be transmitted through the normal breathing of an infected person. For this reason, it is important to maintain social distance from other people, ideally over 2 meters or 6 feet. But we suggest you refer to instructions about social distancing from your local authorities. So let's talk about the ways you might come in contact with the virus. The virus will live on a surface for a varying amount of time, depending on the surface. So if you touch a counter or a door handle or a pole on the subway or buttons on an ATM or any surface that somebody infected also touched, you are at risk. Disinfecting door handles, phones, and other items that are often touched is a good precaution. A package from an infected area is not thought to carry the virus, but we should always clean our hands when touching anything new, including packages or mail. As mentioned, an infected person might transmit the infection during the incubation phase of the disease before they start showing symptoms. Putting distance between yourself and others will reduce your chances of infection. It is believed that coronaviruses originate in other species of animals, but there is little evidence that humans can transmit the virus to their pets or vice versa. As yet, there's no evidence that sunlight or temperature affects the virus. So the best precaution is to consider that it can be transmitted regardless of weather, degree of sunlight, humidity, or many other factors. We will cover personal hygiene to prevent or reduce the risk of infection from COVID-19 in a later video. But it should be emphasized that the rate of transmission of COVID-19 can absolutely be slowed with proper hygienic measures. Hand washing is the #1 most effective defense against COVID-19, as the virus has a fatty layer that is dissolved by common soap and vigorous hand washing. As we're sure you've heard, the proper amount of time to wash your hands is a minimum of 20 seconds. And there are plenty of songs you can sing to help mark the time, including the choruses of Britney Spears' Hit Me Baby One More Time. Or how about just singing Happy Birthday? Hand sanitizer is also effective, but hand washing is preferable where possible. The most important thing that you should strictly adhere to is the advice of your local health authorities in this changing environment, and keep up to date with the recommended and agreed measures in your local area. COVID-19 is an infectious disease and is easily passed on to others in social settings. Because of that, it is really important that you know how to take steps to reduce the chances of infection. It is important that you communicate with your friends and family about COVID-19. Education about risks of how the virus spreads and how to keep oneself safe will be incredibly important tools at this point in time. So congratulations, you're already making steps in the right direction just by watching this video. Explain to everyone in your home the risks and how they can minimize them. Help your children practice social distancing and offer praise for good behavior. Impress on older friends or relatives the risks posed to them and offer to shop for their essential needs, if you are able to. You have probably heard the term social distancing. The concept is that, if possible, people should increase the distance between themselves and others to help prevent the spread of the disease. This means working from home, if that is an option, not going out to bars or restaurants, only being around people who physically live in your home, and avoiding any unnecessary trips outside of the house. Regulations will vary in different locations, so be sure to keep updated with the state of affairs in your jurisdiction. Things like going to the grocery store or walking the dog should be minimized. While doing so, you should keep the recommended distance between yourself and others. Some countries have chosen to impose this throughout the entire nation, closing all non-essential stores and imposing fines on people who are outside without good reason. Of course, for many people, social distancing is not 100% possible given the nature of their jobs. Medical professionals, mail carriers, drivers, and many other people cannot work from home, and their jobs are essential. However, now is the time to speak to your company about the options for working from home, if it is a possibility. Many companies already have remote workers, and more jobs than you might expect can be done at home with just a computer and internet access. Many countries are taking extreme measures to protect their citizens, including imposing states of emergency and countrywide lockdowns. Many schools have shut down. This is because while children do not seem at this time to be as affected as older people by the disease, they can be vectors of the virus and can infect the more vulnerable people in their lives without even knowing it. Universities are switching to distance learning as well to allow students to continue studying without interruption. For parents of school-aged children, lesson plans are already available online through many homeschool organizations, and those can be an excellent support for parents who would like their children to stay engaged with formal education. Around the world, governments are setting limits on how many people can be gathered in one space. This will vary from place to place, but the best thing you can do is avoid any social gathering. This means no visitors to your house, no going to friends' houses, concerts, conferences, comedy shows, or even church. Basically, you should stay away from any place where people are gathered. You might find upcoming travel plans have already been canceled, but in case they have not, you should err on the side of caution and cancel them yourself. It is inadvisable and in many cases not permitted to visit sick or elderly family members in hospitals or nursing homes. Procedures are so different in different jurisdictions that I can't emphasize enough the importance of following local guidelines, restrictions, and regulations. If it is possible to communicate with your doctor via phone or email, do so. It is important to not overload hospitals at this time. You may find that elective and non-urgent surgeries are rescheduled as hospitals are working to cut down on the risk of transmission. Outside of the home, keep a safe distance from others. Frequently wash hands, use hand sanitizer, and do not hug, kiss, or shake anyone's hand. This is a great time to bring back a cheery wave. Avoid any unnecessary, unprotected contact with surfaces in public areas. While this might all seem extreme, experts agree that it is vitally important to stay home and avoid crowded areas to help stop the spread of this disease. Finally, you can cancel plans guilt-free and catch up on all those TV series and home projects you've been wanting to get around to. Let's talk a little bit more about how you can reduce your chances of catching COVID-19. There is no doubt that hygiene is what is going to be one of our best weapons in this battle. One of the most important things to do is to practice proper hand washing. You should be washing your hands after touching outside surfaces, before preparing food, after coming into contact with any person, and of course, after using the restroom as well. Make a habit of washing your hands immediately after coming home and make this a routine for everyone in your household. Wash your hands for the recommended minimum time of 20 seconds. Don't forget to scrub your thumbs between your fingers and the backs of your hands as well. While you're out, use hand sanitizer if it is available. Keep as much distance as you can between yourself and other people, especially if they are coughing or sneezing. If you have to cough or sneeze yourself, do it into your elbow or carry a handkerchief with you. Try to avoid touching your face, biting your nails, or rubbing your eyes or nose. These can be really hard habits to break, but it is extremely important to leave your face alone, as it is thought that this is the most common way that COVID-19 enters the body. If you decide to wear a mask, make sure that you know how to use it properly. Clean your face and hands before putting on the mask. It should fit neatly, covering the nose and mouth without gaps. Do not touch the mask after putting it on, and do not reuse a mask. Remove the mask from behind rather than from the front and dispose of it immediately. There is currently no evidence that hot showers are effective in prevention of COVID-19, nor is there any evidence that using spraying alcohol or disinfectants on your body will kill the virus. You absolutely should not do this, as it can be very harmful to your skin, eyes, and mouth. There is also no evidence that gargling or rinsing of the nose or mouth will prevent COVID-19, and this should not be used as a defense against it. You might also hear that food such as garlic or essential oils such as lavender can help prevent the disease. They will not, and are absolutely not effective in preventing COVID-19. As much as possible, avoid bodily fluids of others. Avoid direct physical contact or proximity to others, including hugging and kissing. At this time, it is even more important than usual that people should not spit in public. Practice food safety in your house to a greater extent than usual, keeping surfaces clean and disinfected. If you suspect that you are not well, you should keep away from other people. Stay at home and follow the procedures advised in your jurisdiction. If you follow these practices, you are much less likely to catch COVID-19. Let's talk a little bit about self-distancing and self-isolation. With some countries enforcing this and others recommending it, there are going to be a lot of people who are staying at home. And let's face it, it will be a struggle. Humans are social creatures, and we're very used to being out and about, going to work, going to the gym, seeing friends, or just taking a nice walk. Perhaps you're at home because you are performing a period of quarantine after possible exposure. Or perhaps you've confirmed mild symptoms of COVID-19 and are in self-isolation. Or maybe your area is in an enforced lockdown. No matter what the case, the following tips will be helpful. Ask your friends and family for help. They can bring you food and medicine, but they should leave it outside your door to minimize the risk of transmission. Keep the recommended distance of at least 2 meters if you know that you were infected. You should be sleeping alone during this time, if possible. And if you live with others, avoid being in the same space as them. Stay away from older people or those with chronic diseases. Do not go to work if you are ill. If you live with people who are at risk, make yourself a space that you can be away from them. Make sure everyone in the house is following the quarantine rules, washing hands properly and not touching their faces. Don't share towels or put used tissues with the family waste. Keep your laundry separate from other people's items. For all people who are facing an extended period in which they should not or cannot leave their home, there will be some difficulties in adjusting to this new normal. It might be fun at first, but there is a reason that we like to go out and do new things. It's a part of what healthy, well-balanced people do. To help prevent undue stress from staying home, try to implement positive routines. There are plenty of exercise videos online. Do one a day to burn off some energy. Cook elaborate meals that you wouldn't have time for otherwise. If you are working from home, get off the couch and out of your pajamas, and if possible, set up an office space so that you have a work area and a living area if you live with others. Try to take time for yourself. This type of situation can make even the most relaxed person a little bit snappy. Many museums are offering virtual tours, or you can take online classes to learn new skills and give your brain a workout. Maybe there is a project that you've been putting off and now you have the time to finish it. Text, call, or video chat with your loved ones. Keep in contact by sending memes or jokes or just cute animal pictures. Take a break from the news as much as possible. Positivity and a good mindset will help you. Remember that for children, this can be a worrisome and disorienting change in their lifestyle. So be sure to spend sufficient time explaining the new reality to them and why these changes are important for their and their friends and families' safety. The most important part is that you stay home. It might be hard or annoying, or you might think that because you feel healthy, you don't have COVID-19. Or if you do get it, it's the same as the flu. This is absolutely not the case. And going out can have devastating consequences for other people, especially the elderly and immunocompromised. Take this time to start some new projects or new habits or learn something new. Even with all the precautions, you might still catch COVID-19. So let's discuss what you should do if that happens. As we have already discussed, many COVID-19 cases are mild. People will experience something no worse than a regular flu. So even if you get COVID-19, the advice you are likely to be given by your doctor or the authorities is to stay home and let your immune system take care of it. If you are showing any of the symptoms of COVID-19, high fever, cough, trouble breathing, fatigue, muscle pain, or sputum, you should follow the procedures established by your local authority, whether this means calling your doctor, a nearby health center, or if your area has one, a COVID-19 helpline. From there, you should follow the procedures exactly. It is important that you follow the instructions of the experts. Be honest and volunteer all information that might help, no matter how small or inconsequential it might seem to you. Your doctor or a health professional may perform a test to check for COVID-19. If one is available in your area and will ask who you have been in contact with, those people may have to quarantine themselves as well. Let your family and friends know the situation so that they can take appropriate measures to protect themselves and their loved ones. All people who have been exposed to an infected person should wear face masks and quarantine themselves for the requisite period. Your doctor will give you instructions on how to care for yourself, and you should follow those carefully. Antibiotics should not be used as they are not believed to be effective against COVID-19. If you are a smoker, you should quit immediately. COVID-19 primarily attacks the lungs, and smoking will make the symptoms much worse. If your symptoms worsen, you should immediately contact your healthcare provider, let them know what is going on, and follow their instructions. As your body handles the infection, try to make sure that you are in a well-ventilated place, wash your hands frequently, and clean the surfaces in your room, if possible. Ask those in your house to keep a safe distance from you and try to keep yourself in a separate room from others at all times. Take good care of yourself, and as you will experience fatigue, allow plenty of time for rest, healthy food, and some gentle exercise once you're able to. We hope this course has helped alleviate some of your fears and questions about COVID-19. With a few sensible measures, we can all get through this together. although at a safe distance from one another. Thank you for watching, and be well.